In-office laryngeal injections. There are many laryngeal conditions which are treated by directly injecting something into the larynx. By larynx, we largely mean the structure of the vocal cords and sometimes a little above and below them. If you have chronic hoarseness, you have difficulty in speaking, you have other problems and lesions related to your vocal cords, sometimes even for neurogenic cough, we resort to injecting the larynx with various substances. There are many ways of doing this. One of them is through the oral cavity. The second is from the nasal passage. And then there are direct injections given to the larynx via the neck, where the surgeon also holds an endoscope to look directly into the vocal cord while an assistant gives an injection from the neck. What are the indications of intralaryngeal injections? Largely vocal cord paralysis, where there is a phonatory gap and you're not able to speak well. We inject certain substances into the larynx to make it more bulky. We inject the vocal cord so that the phonatory gap is closed. Sometimes because of spasmodic dysphonia, we inject botulinum toxin in your vocal cords so that your voice becomes clearer and you can speak for longer periods. In certain chronic benign lesions, we may inject some steroids or some other substances into the larynx. And sometimes for a neurogenic cough, we resort to intralaryngeal injections to make you feel better. An intralaryngeal injection is done under local anesthesia. Sometimes an anesthetist may be there to give you some sedation or to make you feel more comfortable. It is usually done under local anesthesia or a regional blockage. It is a safe procedure in experienced hands, and it is an in-office procedure where you can walk in and walk out within a short period. Admission or hospitalization is not necessary. Once a proper indication is there for an intralaryngeal injection, the surgeon will call you on a predetermined time and date. You may have to go nil, early or fasting for a short period of time. The procedure usually takes about half an hour to an hour or so. The results are usually immediately evident to see. For instance, if for a phonatory gap, some substance has been injected into your vocal cords, you should be able to walk out of the clinic with your voice already improved. Some procedures may take a little while for the effect to be felt and for you to feel the full benefit of the procedure. It is usually a safe procedure. Every procedure may have certain complications. For instance, your voice may not improve, or if too much substance has been introduced into your vocal cords, you may have some trouble in breathing, which is usually temporary and settles down over a period of time. If you have vocal cord problems like spasmodic dysphonia, vocal cord paralysis, certain neurogenic cough, or some benign lesions of the vocal cord which will benefit from an intralaryngeal injection, you must get in touch with us so that we can guide you accordingly.